People in North Carolina struggling with medical debt. Today, Governor Roy Cooper announced a new solution that could help you.
Our chief investigative reporter Nick Oxner was the only Charlotte reporter in Raleigh today, digging deeper into the new details.
Governor Cooper and North Carolina Secretary of Health and Human Services Cody Kinsley announced today a new proposal aimed at wiping out potentially billions of dollars in medical debt for North Carolinians stretching back a decade.
This is a win-win-win for North Carolina.
NCDHHS Secretary Cody Kinsley said the new medical debt proposal would help patients with mounting medical debt and hospitals. Monday, Kinsley and Governor Cooper announced new rules through a federal health care program that would allow hospitals to collect higher reimbursements if they agreed to take certain action on medical debt, including forgiving the past 10 years of medical debt for people on Medicaid or well below the federal poverty level, not selling medical debt to debt collectors for patients well below the federal poverty level, and not reporting medical debt for that same group to credit agencies.
This is the right time for us to move forward. It's always the right time for us to move forward.
They're going to come out financially a lot better.
Cooper and Kinsley pushed back on suggestions that hospital leaders weren't on board with the plan, after a reporter noted Monday's press conference at the governor's mansion didn't have any hospital representatives.
I'm confident that right now the hospitals are looking very closely at the details of the program.
Spokesman for the Leukemia and Lymphoma Society and the American Cancer Society praised the move.
Today, Governor Cooper has made it clear that the status quo isn't good enough.
This just speaks to, the need for an outside box solution. We need to really, think of how to leverage these federal dollars that are coming in.
Now, again, it was notable there was not anyone from a North Carolina hospital at today's press conference. So I wanted to know, are hospitals actually going to take up this new program and implement these new solutions proposed today? In a statement, the association that represents hospitals, the North Carolina Healthcare Association, said, quote, NCHA and its members need more time to understand what is contained in the preprint submitted to CMS by the North Carolina Department of Health and Human Services, which has not yet been approved. Reporting at the Capitol in Raleigh, Nick Oxner, WBTV, on your side.
Nick, thank you. And Novant Health sent us a statement saying, quote, Novant Health is committed to creating a healthier future for the communities we serve, and that includes empowering patients' physical, emotional, and financial health. We have industry-leading policies against predatory debt collection practices and are proud to offer one of the best financial assistance policies in North Carolina and the country that is significantly more robust than the state's proposal. Our long-standing commitment to helping patients manage the cost of care, along with our dedicated financial navigators and consistent promotion of these resources, have helped our patients come to know and trust our policies. We are adamant that any proposed changes do not disrupt or fall short of this commitment.
Got a statement from Atrium as well today. It says this: Atrium Health is committed to addressing many of the challenges affecting the well-being of patients we serve in North Carolina. Given our For All mission, we are keenly aware how poverty and a lack of health coverage are contributing factors to a person's health. Statement goes on to say, while we will be reviewing the details of the proposal, it's worth noting Atrium Health has proactively addressed many of the items in the plan and currently offers one of the most generous financial assistance and charity care plans in the state.